Happy Friday to everyone. This is Ray Pedden from the Center for Care Innovation. Welcome to CCI's Raven e-learning series. The Raven e-learning series has been developed to highlight technology solutions that address priority areas that have been identified by the safety net provider community. The series itself is designed to be a learning opportunity, and we really encourage attendees to engage with the faculty during the session and learn as much as we can. You can see all the future topics in the series at raven.careinnovations.org/e-learning. Today's session is focused on the use of e-consults. We will be discussing how an e-consult can help providers practice at the top of their license, including physicians, mid-levels, nurse practitioners, PAs, and others. 2, how to optimize specialty referrals so the patient arrives ready for the referral as opposed to having to have ancillaries ordered prior to a second visit. Thirdly, how the impact of e-consults will decompress subspecialty schedules to make sure that patients get the earliest available service that they can get. Our faculty for today's session are Carlos Raines and Cyprian Cabuco from Rubicon, MD. Carlos has degrees in bioengineering and telecom management, along with an MBA from Harvard. Carlos and Cyprian have been instrumental in developing the e-consult capacity, specifically in the safety net, and has several publications, including a most recent publication in the New England Journal of Medicine around a joint project that we've conducted using e-consults extensively in the safety net to accomplish the 3 objectives. And just earlier today, I happened to notice a new press release that Rubicon MD has been accredited for 23 hours of CME for effectively using e-consults as a part of helping people understand how to practice at the top of their license. With that, please welcome Carlos Raines and Cyprian Cabuco.
Thank you very much for the introduction, Ray. We are very excited to be doing this together. As Ray said, my name is Carlos Raines. I'm the co-founder and president of Rubicon MD, and together with my colleague Cyprian, we're very excited to take you guys through the journey around what it takes to implement a successful e-consult program. I'm going to start sharing my screen. And let me know if, Ray, are you able to see the screen?
Yep, very good. Yep.
Perfect. So we want to start, before we dive into the implementation of e-consults, we want to start by acknowledging the work that we've been doing with CCI. I think it was at the beginning of 2015 when Rubicon MD was entering California. We had done some early implementations of e-consults, but we were entering California and particularly beginning to work with the safety net. And working with CCI was instrumental to equip us with the technical resources and the guidance to jumpstart our progress. In particular, it was very helpful to have access to the sandbox environments to figure out how to best do EMR integrations. And then over the last 3 years, we've seen an incredible growth through the implementation of e-consults across thousands of clinicians in the state, working with really a wide variety of clinical settings: hospitals, health plans, community clinics, employers that have an on-site clinic. And we've learned a lot through the process, when we're excited to be back sharing our learnings with CCI and hopefully enabling a lot of you that are looking at adopting technology in primary care to really take primary care clinicians to the next level and improve patient care. So before we talk about e-consults, I want to spend a few seconds here talking about the problem. This will not be news to most of you, but it's been studied that about 40% of the visits to specialists are avoidable. And this is a key contributor to healthcare representing almost 20% of the GDP in the country. And at the same time, patients can face over a year of wait time to see a high demand specialty. If you think about the population in the country that has some sort of challenge accessing care, that's more than half. Particularly Medicaid, uninsured, and rural represent 52% of the country, and that really harms patient care. We did a study, as Ray mentioned, with a network of community clinics in the Alameda County, mapping out the entire referral process from the FQHC to a specialist. And I'll save you the pain of having to go through this step-by-step process. But basically, we found that from the time a primary care clinician clicks referral in the EMR until the patient is seen by a specialist and the notes are being brought back to primary care, there can be up to 20 steps that happen over 8 different systems. This is EMR, fax, referrals tools, scheduling systems, paper. 8 different individuals need to get involved in the process, and that'll takes 5 weeks just to process. And then on top of that, we have the typical wait time in the safety net, right? Which is not, it's not rare to see 3, 4, 5, 6 months of wait time for many specialties. So what we see is a process that has an incredible use of resources, really high use of resources, for actually a very low conversion ratio. We learned that in reality, only 2 of those 5 referrals that are ordered actually get scheduled. And then most of the specialty clinics operate with 40 to 50% no-show ratio. So when you think about it, all the effort and time that's put into this for almost no conversion, we're talking about less than or about 1 in 5, less than 25% of the referrals actually happening. And what that means is that the problem stays with primary care, and particularly PCPs in the safety net are very rarely given the resources to take care of a population with needs for specialty care in settings where wait times are really high, and management of care outside of the primary care setting, it's incredibly complex. And that's when we look at the problem and we realize that for all the innovation that happens in healthcare, almost nothing is targeted to primary care. And we decided to make that Rubicon MD's core mission, to empower primary care clinicians to democratize access to medical expertise. And we do that by leveraging electronic consults. And electronic consults are a very well-known concept for clinicians. They've been doing them in some shape or form: curbside consults, ask a colleague, different ways of referring to it. We've taken that process and we've formalized it. So when the patient presents to a primary care clinic and the clinician needs some support in their decision making, they are going to present the case, do a brief description, ask a question, and send that to a specialist who will review and get back to the primary care clinician within a few hours. And based on that input, the PCP can make a much more informed decision on next steps of patient's care. I want to make a quick pause here, and we're going to transition to a quick demo of the platform. We wanted to make sure that we were giving you guys a taste for the workflow of a primary care clinician. And what I'm showing here is the Rubicon Mde Console Dashboard. So as a primary care clinician, I logged into the platform. I can see the list of all the consults that I've completed. Some of them are in draft, some of them are awaiting my review, some of them have been closed. If I wanted to submit a new e-consult, that's when I want to start the process. To enter a new e-consult, enter in patient name. This is many times pre-populated from the patient's chart, so the clinician doesn't have to do it. And take a gender, and I'm going to choose a specialty. This is where we've spent a lot of time at Rubicon MD to make sure we had an incredibly robust and comprehensive panel of specialties. So what we're seeing here is more than 120 specialties and subspecialties. And that's really important because that's what really enables primary care clinicians to know that this is the e-consult platform is their go-to place for any question they have. So let's say, in this case, let's say we wanted to do an e-consult on cardiology, particularly on electrophysiology, and we're going to start the process. And this basically shows the e-consult form basically some patient information that has been entered, some e-consult tips based on the specialty. What are the things that need to be provided to make this a successful e-consult? And then the specific patient information, anything that wants to be shared around relevant background, assessment or plan, and the specific question for the specialist. We also make it very easy to attach files. It can be drag and dropped or selected. And then they can also be uploaded through a mobile app that we've built that allows clinicians to upload information in a HIPAA compliant manner to Rubicon MD. We're not going to submit this one right now, but I want to take you through some of the closed e-consults so you get a taste for what the experience typically looks like. These are real e-consults that we've had on the platform. In this case in particular, we are talking about a 26-year-old male who fell off a ladder and presented to a clinic with an ankle fracture. Had taken the x-rays, which the clinician uploaded so that the specialist can take a look and identify that fracture. And there was a very clear question here. The PCP doesn't think that surgery is needed, and they want recommendations for conservative treatment, but specifically they're trying to get support on what is the best immobilization technique, when is weight bearing permitted, and when this needs to be re-imaged for the patient. And that's the question that goes out. An orthopedic surgeon reviews, and in this case, we have a response where the way they would treat and think about a case like this one is, yes, the X-rays do show a Weber A ankle fracture, which is actually very similar to an ankle sprain, and it can be managed accordingly. Treating, indeed recommending conservative treatment in a regular shoe. They indicate that there will be some swelling, and there can be consideration to a cam boot. They will indicate when high impact activity should be avoided for about 6 weeks, and when the patient can be full weight bearing again. And this essentially is the key relevant information that a primary care clinician needed to manage this case confidently. As you can see, there is some back and forth where the primary care clinician is indicating that this is super helpful and they didn't realize that it could be managed so conservatively. So this is really improving patient care in primary care, leveraging insights from a specialist. And then a couple of things I wanted to show here: the ability to rate the quality of the e-consult. Anything that's not 4 or 5 stars will prompt the clinician to indicate, provide some additional input and indicate why this wasn't as good as expected. And every time that happens, the case is escalated to the Rubicon MD clinical team, who will investigate and understand what didn't go as well as we would have liked, and most likely send the e-consult to another specialist for a courtesy second opinion. The e-consult can be reopened, in this case to ask a follow-up question, to proactively get a second opinion, or to ask a different specialty. So this is a feature that allows the clinician to send the exact same content of the e-consult to multiple specialties, therefore collecting input from several clinicians. And one thing that's really important, we wanted to measure the impact of e-consults in patients' care. So we asked the primary care clinician to report the outcome. They get to indicate whether this e-consult avoided a referral, avoided diagnostic or procedures, improve the patient's care plan, help them learn something new, or none of the above. And then a couple more things. There is a very easy way to download the e-consult from the patient's chart. This creates a PDF report with all the content for the e-consult and the clinical exchange. And this can be used to discuss the e-consult with the patient, to attach the e-consult to the referral process, therefore making it a much more comprehensive referral and providing better documentation for the specialist who will receive the patient, or to bring this back into the patient's chart. And that's a view of the quick overview of the Rubicon Mde dashboard. There are a number of additional features that allow different roles of clinicians within a clinic to get different levels of access. And we also support a very robust analytics dashboard that gives full visibility into everything that's happening in the clinic. Who's using e-consults, what are the specialties that are being consulted, what are the outcomes per specialty, what are the turnaround times, what are the ratings. Really everything that's happening on the platform is fully visible, and it can be analyzed through different timeframes and different aggregations, looking at it daily, weekly, monthly, any time frame that a user would want to evaluate. Going back to the slides, I wanted to share some of the use cases that we're seeing through the platform to really feature the impact that eConsult can have. This is one of our favorite cases at Rubicon Mde because of the huge impact. Early on, a primary care clinician submitted an eConsult after a mother presented to the clinic with her 3-year-old kid, where she had scratched the right eye corner with a lollipop stick, and therefore had a wound near the eye, and an e-consult was triggered. The primary care clinician took a photo, uploaded it to Rubicon Mde, and asked about diagnosis, tests, treatment, acuity. That e-consult was submitted. The specialist happened to be online. In less than 20 minutes, there was a response back where the dermatologist expressed concern with this case potentially being a herpes case. And a herpes case on a 3-year-old next to the eye really entails a big risk of losing the eye. So the recommendation was to start urgent ophthalmology consult by sending this kid to the ED. That happened the same day. The kid was sent to the ED where the herpes infection was confirmed. Fortunately, treatment started immediately and the eye was not affected. And this is a case where we see how that excellent combination of primary care leveraging specialty care insights really enabled patient care, right? We could be talking about how Lucia lost the eye. Fortunately, we're talking about a great intervention where primary care was able to meaningfully drive value for a patient. And when we had one of these cases at the beginning, we thought this was an exception, but we've seen that every 100 or 150 e-consults, there will be 1 or 2 high impact e-consults where this is meaningfully changing the ability to provide care and avoiding severe complications. A little bit more on the list of specialties. So as I mentioned, we feature more than 120 specialties and subspecialties. We knew that we had to provide something that was incredibly comprehensive for clinicians to be able to provide the best possible care, and at the same time for the eConsult platform to be very intuitive, and clinicians needed to know that they could come to Rubicon Mde for any question, any patient on any specialty, and they would get a 5-star response within a few hours. Obviously, within that list of specialties, there are some subspecialties where e-consults are utilized more frequently, and that is a combination of the cases that are more frequently presented in clinic, the things that lend themselves to be better served through e-consults, and also the different access challenges that we see in the safety net. But in particular, dermatology, it's very easy to upload photos and get opinions on rashes. Cardiology, where EKG readings, arrhythmia evaluations, hypertension. Endocrinology, thyroid issues, bone issues, complex diabetes management. GI, hematology, a lot of help interpretation, blood work analysis, neurology, OBGYN, orthopedics, which is an example of orthopedics. These are specialties that are very frequently utilized. But as we said before, we really wanted to have everything and made sure that we had a very comprehensive list. things that are less frequently consulted with, but are very important. Things like transgender care, things like genetic counseling, palliative care. Those are not consulted on a daily basis by a clinician, but it is incredibly powerful for them to know that they can go to Rubicon MD for any questions they may have. And I wanted to talk about impact and results. We saw this is a cool tool, but is this being effective? Are clinicians driving value out of it? So these are the results of the surveys that we are capturing through the platform. Incredibly high ratings, 4.9 out of 5 stars, consistently week on week. This is the result of having an incredibly curated and highly trained specialist panel that are really good at doing e-consults. Not only really good clinicians, they're also really good at teaching through e-consults, which is the purpose of the platform. And then in terms of impact, 80% of the e-consults, the primary care clinician reported a significant improvement of the care plan. And that to me is one of the most impressive things we've achieved, that almost every e-consult is really enabling primary care to practice at the top of their license. Furthermore, 65% of the e-consults are educational. They're not only being able to improve the care plan for their specific patient, but they're learning from these so they can leverage the same learnings for patient care going forward. And then 52% of them avoiding unnecessary services. We talk about the number of unnecessary referrals, diagnostics, tests, but we do see that e-consults result in avoidance of unnecessary downstream services. And that not only has a very positive financial impact for the healthcare system, but as Ray was mentioning at the beginning, it opens up capacity for cases that are more complex and more urgent and really need to be seen by a specialist. So this is making the system much more efficient all around. And also very impressive to realize that there is only 2 in every 100 e-consults that are not driving the value that we wanted. Really small number. But e-consults aren't just a technology. We've talked about the Rubicon MD interface. We've talked about the Rubicon MD panel of specialists, but there's more than that. The operations. How do you work on a system that consistently delivers high quality responses in a matter of hours? Rubicon MD's promises to deliver responses within the day, but our average turnaround time is typically 3 to 4 hours. Clinical transformation. It's not just about dropping technology in primary care. It's all about how to empower primary care clinicians to adopt a new technology. Primary care clinicians are busy. They're seeing a very high number of patients. They always have patients in the waiting room. They are frustrated with technology because EMRs have them clicking through nonstop. It's very important to understand the workflow of a clinic, the leadership priorities, and work with clinicians to customize the training so that they understand how to use the technology and how to drive value for their patients. The analytics become an incredibly important part of it. Real-time reporting for clinical staff. Clinical leadership wants to know where their clinicians are driving value and where their clinicians are having gaps that they can help fill with more support. And more broadly speaking, continuing education. This is a tool to help primary care providers learn more and practice at the top of their license. So we started a few years ago doing on-demand CME forums. Basically, we were identifying topics that were frequently sorts of questions through e-consults and use those to develop specific sessions to help primary care be able to handle more of those things themselves. And the natural evolution of those CME webinars has been the announcement, as Ray was mentioning, announcement today that as of October, Rubicon MD has been accredited to offer CME credit. So the AAFP and through reciprocal credit organized by the AMA, the AANP, the AAPA, clinicians can now get up to have a CME Category 1 credit for e-consults that they complete on Rubicon MD. And this, to us, sets very important milestone because we've been showing the value of eConsult, showing their educational value and how clinicians are learning from it. And to get the endorsement and the recognition that clinicians should get CME credit, it's a great accomplishment that I think benefits primary care clinicians at the core, and it will make eConsult adoption more effective at the clinic level. I want to spend a couple minutes sharing a bit more information on Rubicon MD as a company. We are bi-coastal. We have one office in New York and one office in San Francisco, but our presence is really across the country. 36 states where Rubicon MD has implemented the service with more than 5,000 clinicians. And this really includes a wide variety of primary care settings. One of probably our largest area of focus is the safety net and community clinics. In many countries, we work with community clinics directly. We work with community clinics through their health plans. We work with rural clinics, places where access is a big challenge. Clinicians have found this to be an invaluable tool. But we didn't stop there. We've tried this across many different populations. We work on commercial populations through employers that have an on-site clinic. We've worked with Medicare population through clinics that do fully capitated primary care implementations. We've worked with hospitals. We did the implementation for the Zuckerberg San Francisco General Hospital, where they've been using eConsults for over a decade. One of the thought leaders in the country on eConsult implementation and the authors of most of the research on eConsults, and they made the decision to roll out their platform using Rubicon MD. We've worked with correctional facilities, right? Providers that are caring for inmates inside the wall, very complex setting, very difficult to arrange transportation for an inmate. Another setting where they want to be able to provide the best possible care by leveraging specialist expertise. And sharing a little bit of our partners. This is a combination of groups where we've aligned in partnerships, groups like CCI or the California Healthcare Foundation, where we are very aligned in our mission to improve access for the underserved. And I wanted to leave the group here with a reflection of the impact. Right, we've talked about the outcomes, but when you break it down for the patient and for the system, just in the last few months, we've looked at, did an analysis and understood that by doing eConsults, clinicians have been able to leverage an incredible amount of dollars, medical savings for the system, but also for patients in terms of out-of-pocket costs avoided. And what's even more important, more than 500,000 patient wait days avoided. This is the time that the patient would have needed to get to the right care plan and how that gets accelerated when their clinicians use Rubicon MD. And the corresponding time that they would have had to spend seeking care, right? Almost 100,000 hours seeking care. That for an underserved population becomes very challenging because they not always can afford transportation. They not always can afford to take time off work. If they are, hourly workers or their jobs aren't that stable, it's not that easy to take the time to go see a specialist, particularly when it is not necessary. And our impact keeps growing as we advance more and more partnerships with some of the best primary care networks, some of the best specialty networks, always with a strong mission to democratize access to medical expertise so that all patients' populations receive the care they need. I'm going to stop here and see if there are any questions from the forum, or Ray, if you want to guide the Q&A session as well.
No, I'd just like to reinforce opening it up to the broader audience, and want to thank you very much for taking the time to go through this. So folks, now is the time to ask and learn from Carlos and other people that are in the session around eConsults. So please do not be bashful.
this is Cyprian from Rubicon MD. While the audience musters up the confidence, one sort of food for thought I'd love to throw out there. Now know that Medicare has approved reimbursement codes for e-consults. We know that Medicaid in California is considering approving these codes or their own codes for Medicaid reimbursement as of January 1st. Curious to see how that affects the folks on the call, how they're thinking about an innovative service in lieu of the ability to reimburse for this now.
If you want to make a comment or ask a question, you'll have to unmute yourself. I noticed that everybody is muted, so.
Hi, this is Story from Santa Cruz Community Health Centers. Do you pull in demographic information into Rubicon so that the provider can find the patient easily?
Hi, Story. Thank you for the question. Yes. So what we do on Rubicon MD is we the primary care clinician will pull in demographic information onto Rubicon MD. However, that information is not sent to the specialist because we wanted the e-consult to be just about the clinical question. So from the specialist standpoint, they don't really need to know who the patient is. All they want to know is this is a female 37-year-old with a presentation of A, B, and C, and this is my clinical question. And with that way, we make sure that we are focusing on the clinical exchange. That said, the primary care clinician can always go back to the platform and search for patient name, last name, and pull out the old e-consult that had been completed for the patient.
And do you interface with eClinicalWorks?
We have an integration layer that's compatible with many electronic medical records. And basically, there are different levels of integration. The most basic level, we do single sign-on, which is basically enabling the clinician to log into Rubicon MD with the same credentials from the EMR, so they don't have to keep separate logins. And then we can work on importing some demographic information, and at the same time, bringing the notes back automatically into the patient's chart. One of the key learnings from the beginning, when we were doing full integrations for all the clinical information, is that we have to find a balance between making it easy to import information so that clinicians can submit these easily, and at the same time avoiding a data dump onto the specialist, because the value of the e-consult is generated in the 3 or 4 minutes that the primary care clinician has to spend putting their thoughts together, summarizing the case, presenting it in a clear way, and asking a targeted question. And we've seen that finding that right balance between making it easy to access and import a patient context, but letting them present the case has yielded the best results for the clinician-to-clinician exchange.
Thank you.
And specifically to your question on ECW, the technical staff at Rubicon has been granted credentials now to the ECW sandbox and is beginning work on going beyond just a single sign-on capability to a more robust interface to ECW. And if you're on ECW and you'd like to give feedback on what the workflow looks like on ECW, once they get to a point where they're willing to show us in an alpha or a beta, let me know and we'll put you on the review group, Story.
That would be great. Thank you.
And sorry, since we have a small group, I would love to get your reaction to the presentation and sort of ask you whether you guys see some of the same challenges around access and supporting clinicians in primary care, and how do you think about implementation of e-consult for your clinic?
Well, yeah, I mean, referrals in general are a very painful process. We're constantly having to figure out who's going to take our managed Medicaid patients and who isn't, and, you know, constantly updating information inside of ECW. It's also, what I'm trying to figure out is how this is not going to be a burden on the providers, because currently right now they create the referral, but then we have referral specialists who manage everything else, following up with specialists, getting a TAR to have it approved by the insurance, checking in to see if it's done, and then getting the information. And so I'm trying to figure out how the Rubicon portal would not put a burden on providers as much, you know, pulling the information back into the patient's chart and so forth. And that's, you know, just looking at that. I think overall, I mean, our top referrals have to do with obviously dermatology, gastro, and physical therapy, OT, PT. So some of those things you can do, but some you can't do online. So, and also our managed Medi-Cal payer is looking to implement eConsult as part of our quality-based incentives. So I'm looking at platforms.
Got it. Is this through the alliance?
Yeah, exactly.
Got it. Okay, perfect. Yeah, I think you bring up a very good point, and we acknowledge that the true value of the eConsult generated by the primary care clinician taking that extra time to present the case, and we know that is challenging when they are overloaded with patient care. We've worked to simplify the process as much as possible, and we enable different workflows. So, you know, someone who could be an MA, a referral coordinator, or someone in the medical records department, they get access to the platform so they can download the notes, bring them to the chart, and take on some of the logistical follow-up actions with the patient in case they need to process a referral or they need to bring the patient back. So clinicians leverage that. Overall, the value, we were discussing at a similar situation. We were discussing with a clinician who came to our office last week, and same thing. She said, we are a safety net setting. We struggle. We send our patients out. They don't want to take them. And she really needed a rheumatology visit, and rheumatology wasn't scheduling their patient. And they attached the eConsult to the referral process, where they were able to demonstrate the specific reason why the patient needed to be seen in rheumatology in a timely manner. And the head of the department called back, and they scheduled the patient. So one of the things we've learned is that it actually makes the referral process a lot more seamless, not only because they are avoiding unnecessary referrals, but also because the referrals that are needed are now fully worked up, directed to the right specialty, and that ability to share that clinical exchange with a specialist, as opposed to a referral, which maybe, you know, said something like chest pain or abdominal pain, makes it a lot more likely to be successful through the process. So, you know, recognizing that it takes additional time for primary care, we see that drives a tremendous amount of value. And as you said, not all referrals need to be an eConsult, and not all eConsults are tied to a referral, right? Referral to PT probably needs to be a referral without the need for an eConsult. And a clinician who's taking care of a patient may need an eConsult to improve the care plan, even though they wouldn't have referred anyways, and they're just leveraging it to do their job better. But yeah, they bring up very good points.
Okay, thank you.
I would add two quick things. When you think about the submission time, the web-based version, our average submission time is about 7.5 minutes. And those clinics that choose to leverage our EHR integration layer, where they can do single sign-on and data exchange. About 2 to 2.5 minutes is the submission time. But generally in all settings, our provider satisfaction rates, as attested to by primary care provider, are 4.9 out of 5 stars, or 97% satisfaction.
Okay, good to know.
Are there any other questions from the group? Questions on our experience with eConsults, on Rubicon MD, or plans going forward? We're happy to address those.
Carlos, this is Ray. It sounds like you guys did a great job, given that people understand what you're saying, and hopefully will take advantage of the knowledge that you've delivered to the group today. I personally want to thank you very much for taking the time, and I'm certain that everybody who was in the e-learning session goes away with some portion of information that they may or may not have had before. So I really, really appreciate the opportunity to have you guys as faculty, and look forward to working with you for a very long time.
Great, thank you very much. It's a pleasure to be supporting CCI and sharing our learnings back with the group. I've left my contact information here. It's carlos@rubiconmd.com and rubiconmd.com for our website. If anybody wants to reach out to get more information, please feel free to contact us. Ray, thanks so much for all the work that you guys do supporting innovation in the safety net.
Thank you so much.